Hello. So, you haven't heard from me about my collarbone injury, my surgery for a while now because things get busy. I'm back to being close to normal. So, yeah, 6 months since my injury and surgery right now. I've had a lot of people reach out through my videos, ask me how I'm doing, and they've suffered the same injury, had a similar surgery, and are comparing themselves to my recovery, and are reaching out for help, trying to figure out how to best get back to the sports and activities that they love doing. What do I experience 6 months later? Big thing is altered sensation in the area. So like the scar, when they cut through to do the surgery, they cut superficial nerve. So I still don't have great feeling. I have a little bit. I get random tinglingness. It aches on and off, especially where I am in Calgary. You have these things called Chinooks, where in the winter, the temperature changes rapidly, and there's a big change in pressure in the environment. So I do get achiness and stiffness around those times when we're seeing a 20, 30 degree or 30 degree change in temperature during the day. I still somewhat uncomfortable sleeping on that side, so I normally prefer to sleep on my left side, but if I want to roll over, sometimes I am waking up if I roll over onto my right side. Yeah, so that's the big thing, is the altered sensation and the stiffness and that goes along with it. But ultimately, yeah, now even after a hard upper body workout, I don't get a lot of tension and soreness, which I was only a couple months ago. That was just partially stressing the bone. The bone's still remodeling. It takes about a year to be fully remodeled into real bone versus just calcified tissue. So that's ongoing, and that's why I continue being active, lifting, doing things. I'm doing power movement, high speed things to make sure that neurological, that quick firing, which is ultimately where many rehab programs stop before that, and which is when somebody comes and works with me because they're having problems, they're not performing the way they want, is because they stopped 80% of the way there, didn't get the high level strength and high level power back in the injured body part, and then they realize they're not performing well, they're maybe compensating around it and potentially injuring something else, because over time those compensations can lead to potential injuries down the road. Yeah, so that's where I'm at. And when you're comparing yourself, like when you should start rehab, what you should do when, they're obviously lean on your surgeon, lean on your healthcare practitioners, or what they know, what typical, because everything I started, basic range of motion and some muscle activation days after surgery. Some people I hear are starting rehab 2 to 6 weeks. Pretty moderate rehab, 2 weeks after the surgery is very reasonable. 6 weeks, starting to get kind of late. You're getting a lot of restrictions in the tissues if you're still immobilized. Yeah, and 6 weeks is even nuts when the bone is strong enough to take a pretty step. Start loading it heavily. This is not full-out training, high-speed ballistic stuff, or else increased risk of re-injury is occurring. So and it also depends on your injury, your surgery, because there is differences how much damage was done to the collarbone. Was it fragmented? Was it just a clean break? That's not, that's just displaced. Was there other injuries associated with it? Where there's other parts of the shoulder, other parts of the body, those will affect how you also take on the rehab. Because I've worked with people that have had multiple joint dislocations along with the collarbone fracture, so that made things much different. So always find somebody that's qualified and experienced and comfortable working with your situation, as well as doing your own basic education, so you can be a active part of the decision making and bounce ideas back and forth with your healthcare practitioner, if any coaches are involved, and surgeon, and then ultimately get the best outcome for yourself. So yeah, if you're going through all my videos on my cuff rehab, my collarbone surgery rehab, yeah, feel free to reach out in any of them, ask specifics. I try to get back. I'm usually pretty good at getting back within a day or so on any of them. So all the best in your recovery if you're going through the same thing, and I'm happy to help if you need any.